morning I'm talking with Hannah Rachel Kruman. Hannah is a narrative therapist and a body and mind counseling therapist. Hi, Hannah, how are you?
Hi, I'm also a marital and family counselor from the old days.
Excellent, excellent. Hannah, what is mind and body counseling?
So in the old days, what mind-body counseling was is that you did a bunch of physical stuff to work out your problems. When we combine mind-body with narrative, what it means is that people who aren't as verbal and who don't like to get as cerebral as others, they can close their eyes or open their eyes, they can feel the experience, they can talk about what's happening inside them or that feeling of what surrounds them, and nobody's going to think they're crazy, right? So this is the kind of conversation that we're rarely allowed to have. So for example, I might feel guilty, and that guilty might be a lump in my heart, right? Or I might feel afraid, and that fear might be, a tension in my stomach. And from that space, we look into movement, we look into ideas, we look into feelings. So we expand it and make it bigger, and then we turn it into a dance. We call it the dance of identity. What would this dance have you doing? What does the dance want from you? What is the dance moving you towards? What is it moving you away from? And the person can dance the whole thing out. They don't even have to talk. But also, if they want to, they can use words, but just to help them with their process rather than as the definitive way to become better. So what happens is they're more
about movement and less about actually verbalizing.
Well, some of it is movements, and some of it is physical feelings, and some of it is a sense of things. Some people work very intuitively, so what we would talk about is what their sense of the world is, and where do they get that, and how big is it, and is it like a cloud or a fog, so no matter what their somatic impression of life is, we respond to it, and we work with it, and we don't make them talk. We rather ask them how they'd like to explore the situation.
And if somebody wanted to combine the two, if they wanted to combine the mind and body counseling with the narrative, would that be an option for them?
Usually that's what we do. There was rarely, one or two times that somebody had lost language, and so movement was their doorway out of that place where they had gotten lost. Lots of times when something shocking happens, language goes. So we have a way to respond to that using art or movement.
And if somebody was doing the mind and body counseling or even the narrative therapy, how many sessions does it involve? Is it something ongoing? Does it depend on the individual? What do you normally find happening?
Well, first of all, the mind body is narrative. It's just a branch of narrative. And how many sessions? You'd be shocked how short term this can be. Would you like to hear a quick story?
Yes.
So there was a woman who came, and she had had a child who was special, and she was having a real hard time adapting to that. So the child was, let's say, Down syndrome. And so she came in, and she was very upset that her child was suffering Down syndrome, and the child hadn't hugged her. And it had been a couple years since she had brought him home from the hospital, and the child doesn't touch her much. She was very upset about this. So we created a sense of what that was. She talked about a pain in her heart. We asked her to move with it. We asked her to let it get bigger. We asked her to turn it into a dance. And all of a sudden she said, when he was born, I decided that he was not a person. And she started to cry. And that was the whole session. And she went home, and he hugged her for the first time without a word. She got out of the taxi, and she said, literally, whatever that decision had done to them, it had pushed away the possibility of him being affectionate to her. So since she had kind of remade that decision that day by realizing it had affected her, the boy picked up on it, and that was the whole therapy, that session. So I've seen things, change can happen immediately, change can happen gradually, and we're open at the Jerusalem Narrative Therapy Center to any kind of change that's possible.
Thank you, Hannah. Thank you so much for sharing that with us.
Okay.
Thank you. Bye.